Hi, this is Dr. Abbasi, interventional radiologist and associate professor of radiology. Here, I'm going to share my interesting cases with you. Welcome to my dark room. Here, I'm going to present a 37-year-old woman presented with vague abdominal pains. Contrast enhanced CT scan in portovenous space shows a mass within the pancreas. Here you can see the cystic mass with some septi, the pancreatic head and neck, and we can see a small angular part of the pancreas encircling the lesion. It's called claw sign, and it's a sign of the mass being located within the pancreas. As I'm scrolling the images, you can see mural calcifications and some parts of lesion with mural enhancing nodules. While approaching pancreatic cystic neoplasms or lesions, if you put pseudocysts, serous and mucinous cystic neoplasms and IPMN in your differential list, you will constitute more than 90% of diagnosis in your routine practice. If you live in an endemic area for hydatid disease, do not forget to include it in your differential list. In the current case, the presence of a macrocystic lesion within the pancreas, associated with peripheral calcifications and enhancing mural nodules, makes mucinous cystic neoplasm the most probable diagnosis. I admitted the patient for a core needle biopsy, thinking that I would be dealing with a mucinous cystic neoplasm. In order to prevent peritoneal seeding, I used the coaxial system to aspirate the fluid, and the cyst returned this type of bloody turbid fluid that is something that I don't usually expect to see in mucinous part of MCMs. So, as we live in an endemic area for hydatid cysts, I thought maybe this was a hydatid disease and asked my nurses to inject 100 milligram of intravenous hydrocortisone to prevent possible anaphylaxis. But to my surprise, the fluid came back negative for both CA99, that is a marker of mucinous cystic neoplasms, and for hydatid scoliosis. And the corneal biopsy from the solid parts of tumor was positive for neuroendocrine tumor. That's left us with rare differential diagnosis of cystic pancreatic lesion that is solid lesions with cystic components and includes neuroendocrine tumors, pancreatic ductal adenocarcinomas, solid pseudopapillary tumors, and metastasis.